Michael Collins, on behalf of the Rural Independent Group.
Thank you, Taoiseach. I have no doubt after the easing of COVID, the biggest single crisis this country will have to deal with is health and waiting lists. At the present time, Taoiseach, we are shockingly ill-prepared for the crisis, which leaves many questions hanging over the head of the Minister for Health. Just look at your own county in West Cork and the shambles with health is at the moment, where hundreds and hundreds of people are going north for crisis operations as they have no other choice. Look at the shocking handling of Bantry General Hospital during the summer. West Cork's only general hospital, serving up to 90,000 West Cork people and tens of thousands of visitors, where A&E admissions were closed for 16 days due to a lack of staff, something, Taoiseach, which was flagged 3 years prior, but due to major incompetence by the HSE, it was not addressed until the HSE was pulled, dragging and screaming through the streets of Bantry by the great people of West Cork in a public protest before they woke up and reopened A&E. And all this time, Minister, the Minister for Health was nowhere to be found, which looked like, yet again, another minister asleep at the wheel. Look at Southdock in Castletownbere and Kinsale, which is now non-existent. Imagine the people of Argroom, Allihies, Adrigole, Orden, Glengariff, Castletownbere and Lorach and South Kerry spending every night without a proper out-of-hours doctor service, unless the day doctors in Castletownbere continue to work by night, which is shocking to ask anybody to work day and night. This coupled by a crippling ambulance service in West Cork, where the Castletownbere ambulance, one of 4 in West Cork, spends their nights now in Kerry, the Clonakilty ambulance, which is now dubbed the Cork City ambulance, and every night during the week leaving the other 2 ambulances in every other part of the country but West Cork, leaving car accident victims recently in West Cork lying on the roadside 2 hours 45 minutes and 2.5 hours respectively, with guards and fire personnel to care for them. Also, we had a suspected stroke victim in Skull recently while they try and source an ambulance from another county, and another person near Skibbereen passed away while waiting for an ambulance from another county. This leaves ambulance staff, fire brigade staff, doctors, guards and suffering patients and families astonished as to how this is allowed to happen. All this, Taoiseach, is over the past 2 months, and all is happening on your watch. And if this is not enough, now Coaction have decided to close their community houses in Castletownbere and moved loved ones with intellectual disabilities to Skibbereen or Bantry, which is nothing short of heartbreaking. Again, the excuse is lack of staffing. The same excuse used for Bantry Hospital recently and for Southdock. And now the most vulnerable in our community will have the doors in their community homes, some who I may add are in their 50s, 60s and 70s, shut in their face. Another astonishing attack on the vulnerable people of West Cork. Taoiseach, can you answer me why was Bantry Hospital allowed closed its A&E at the busiest time in August of this year, why there is no Southdock out of our service in Castletownbere and Kinsale, and why is there no ambulances in West Cork most nights of the week, and can you personally intervene with Coaction and prevent many heartbreaks with the closure of the Coaction in Castletownbere homes, I may add, which were fundraised by the local people?
Thank you, Deputy Collins.
I think the performance of the health service in the last year has been exceptional in respect of particularly dealing with COVID-19, both at the primary care level, at the acute level, and I think great tribute is paid to all involved, particularly all those who worked in West Cork in our ambulance service, who did fantastic work in bringing vaccines to people who were bedridden or who for mobility reasons couldn't leave, to the GP infrastructure across West Cork for the extraordinary work that they did, and I think you should have paid tribute to them for that outstanding service that the health service did provide in the most difficult of times during a pandemic. It's easy to be condemning all of the time. I also want to say that during August I was very well aware of the Bantry situation. Deputy Christopher Sullivan contacted me on a daily basis. It was no surprise to anybody as to what had transpired in terms of personnel issues, really, not policy. You know that. If you had bothered to ring the hospital or ring the HSE, they'd have explained it to you, and they did, I think, eventually talk to you about it. And the resources have been provided for Bantry Hospital, and I think there's been continued consistent investment in Bantry Hospital, and the Minister for Health did engage with the issue. There was some, and I don't want to go in, obviously there was personnel issues, put it that way, in terms of availability, which was beyond anybody's control at that particular point in time. But that was dealt with by the HSE in the South West. And Bantry Hospital continues to play a very significant role for the entire hinterland because of the extent of West Cork right down to the Kerry border, to Castletownbere and so on like that. So, and I have always been a strong supporter and advocate for Bantry Hospital, even in my own time as Minister for Health, and we did secure significant investment for that hospital and also identification of it as a unique type of hospital given its location and its need to service, as I say, a very large rural hinterland. And in terms of it's a national ambulance service, as you know, and any improvements that can be made, we will continue to work at to ensure a provision of supply. And in terms of the waiting lists, the Minister will be producing an action plan in respect of waiting lists, both from now to the end of the year and right through 2022, because it is an enormous challenge because of the fact that we've had 2 lockdowns over the last 15 months and more, since last March of 2020, which did impact on the capacity of the acute system to get operations done. That's no surprise to anyone, and that was adding on top of a list that had built up in the previous number of years. So there'll be an all-out effort to, first of all, reduce waiting times for people in respect of acute hospitals. But there has been significant progress made on assessment of need, very dramatic reduction by 91% in terms of the number of children, for example, who are waiting for their assessment to be completed in the last 12 months. Minister Anne Rabbitte did great work there, and I know Minister Rabbitte will happily work with co-action in respect of any issues that co-action have, and I've been a long-term advocate of co-action as well, and supporter of co-action down through the years.
Deputy Collins.
And thank you, Taoiseach, for your reply. And I do welcome that Deputy Minister Rabbitte would work with us in relation to the co-action in Castleton-Bear. It's a very serious issue and a very upsetting issue for many of the families. And I know of it for the last nearly 2 weeks, and I didn't break the news until I was getting no reply from co-action itself as to what is going on there and why are they closing the residential homes. And just for your own information, I was well aware of what was going on at Bantry General Hospital. But the HSE were aware of it for 3 years. Do you not know that, Taoiseach? They knew this for 3 years was coming. For the past, and the consultants there have told us that, right? So this is the facts. The facts are, I'm well aware of what's going on in Bantry General Hospital. It's my back door. I respect the staff that work there. I don't respect the way the HSE left the people down and left the hospital closed. And you said you knew of it every day of the crisis. You were invited down to the protest. You should have stood with the people. Stood with the people. And that was where your voice should have been heard, but you failed. You failed the people. The same as South Dock. They come back to us, the HSE last week tells me South Dock and Castleton-Bear was resolved. It lasted 2 days. It collapsed. There's no South Dock service there by night. So there is a failure. You can praise all there's great staff on the ground, ambulance staff, second to none. But the bottom line is that the problems are at the top in this country. Overpaid management, layers of management that collapse continuously. And you're in denial here. You want to say you knew about this every day of the week. 16 days admissions closed to your local hospital. If it happened in Dublin, there would have been a national outcry. It wouldn't last for hours. But when it was down in West Cork, it was all right to talk about it for 16 days and push it aside. As you don't understand, Deputy Collins, what's going on. I certainly did know about it. I was told it was we were spreading myths about Bantry Hospital. It was a fact they closed the doors there. Open up your eyes and wake up to what's happening. It's happening in your backyard, in your watch.
Thank you, Deputy. Taoiseach.
It's a great phrase, Deputy, and it's a regular, asleep at the wheel, on your watch. Every week, every time you're contributing, that seems to be the standard terminology. But the bottom line is this: in terms of Bantry Hospital, the commitment and in terms of the recruitment of additional personnel and the replacement of personnel, they worked fairly quickly, in my view. And got those issues resolved. And we're not talking about a standard accident in the emergency department here either, you know that. And it shouldn't be referred to as an A&E, because it's not an A&E. Talking about a medical assessment admissions unit is what you're actually talking about here. It's not an A&E. But it's not all right. Let's not make it overly dramatic, and that's an important point. But I think the hospital has, over the years, created a very important role. And I think what's important is that we support what the hospital does well. And resource that. And that's what we're committed to doing. And I've intervened to make sure that that happens, as has the Minister for Health, because of the geography of that area. It's obvious the need for the hospital and the range of services that it provides.